Becoming a new mom can bring on challenges you may not expect. During the first 2 weeks after giving birth, you may feel anxious, have trouble sleeping, be sad, or irritable. This is commonly known as the baby blues. But after 2 weeks, if you still have the blues, then you could have postpartum depression.
Postpartum depression is depression. It just happens to happen after the postpartum period.
Dr. Sandra Torrente is an OBGYN at Kaiser Permanente, San Francisco. She says a new mom can be diagnosed with postpartum depression up to 12 months after giving birth. She stresses there's a combination of factors that put women at risk for this illness.
You have a hormonal change from having a drop in all the hormones after being pregnant. You have this huge life event, which is the birth of a child, and then you are exhausted.
Women who have a history of depression before pregnancy are most at risk for postpartum depression. So make sure to tell your doctor if you have a history of depression when you get pregnant. Another risk factor, being in an abusive relationship.
Because this is like this grand time in your life where you should be excited and you want to share it. And so many times women who are in abusive relationships end up feeling like it's not this beautiful thing, but more of a stressful situation. And so they're at risk of having postpartum depression.
Symptoms for postpartum depression may include loss of appetite, intense anger and irritability, difficulty sleeping, no emotions for the baby, thoughts of harming yourself or the baby. If you're experiencing any of these symptoms, make sure to talk with your doctor because he or she can provide you with ways to relieve the pain.
There are the biological factors that we can give women, including medicine, behavioral changes. There's the emotional support or psychological, which would be group therapy. And then lastly, nutrition. So we want to make sure that women are eating appropriately, sleeping appropriately, avoiding alcohol, avoiding cigarettes. But again, I emphasize the support. The support network is important.
That support can come from your partner, family members, or moms groups. Dr. Torrente also suggests that depressed moms get some sun because sunlight does help you feel better. So go outside or sit by a window with open curtains or blinds. And getting enough sleep and eating right is important.
Because you're focused on taking care of a child and not taking care of yourself. So I try to tell women they have to continue to take care of themselves to be better moms.
For the WIC Show, I'm Paula Laverde.